What's up, YGTV? It's your boy Carmelo, man. I had to, get on here and make me a little video about me being kind of, ill during these trying times. You feel me? Basically, I just got a job at the hospital, and I had a little talk with one of my supervisors, and told him like, I do have a problem with being in the healthcare system and, not being able to wear PPE because, it's a lot of stuff going on in this world. And one thing going on is that coronavirus is very prominent. It's going around. So I do have a job I do like on the side and on the weekends. I'm working for home healthcare where I have my own one-on-one patients. And, that company allows me to, have my mask, have my gloves and different stuff. So it was a little bit different and unfortunate that I just got hired in a hospital here in Michigan. And the company, you can't wear masks and, gloves in the hospital. We are dealing with patients who come in from the ER, and we do visit the ER in different floors. And sometimes it takes a while for the doctors and the nurses to get around to the patients to even treat their patient. We all been sick and we all have been to the hospital before, and the process is we have symptoms that may be sometimes unusual, and we want the advice of a doctor or a medical professional. So we go to the hospital, you feel me? We go, let them know what's going on with us. We wait a little minute, they call us to the back, and we're in the emergency room. So, if you got us transporting in and out the emergency room, sitting with patients as a sitter in the emergency room, and we're not allowed to wear gloves unless we're entering a room, touching, unplugging, or unhooking, or plugging back up the equipment and taking the gloves off. So while we're transporting the patients or sitting in the emergency room or throughout the hospital with them, they could be coughing or whatever, and we're not allowed to wear this. It's crazy. And it's crazy because I feel like, I asked the manager, I don't like germs, I don't like coughing, people coughing on me and different stuff, and I want to be protected. And he's like, no. Where our policy is, we don't allow. So at this point, I'm sick, have a dry cough, fever come and go. I'm just up coughing all night. That's why I know, my symptoms start getting bad. And it went away. Then when I went up to the job today, to let them know, hey, I don't feel good. And, I'm coughing. And can I wear a mask today? And they like, why you didn't look on the paperwork? You could have called off and you ain't had to come in here. It's just so simple. So dismissive. So they don't protect us. Can't wear gloves unless we're going inside the patient room, unplugging the patient, touching anything in the room. We can wear gloves, whenever, no mask. It's just crazy. I just don't understand it, and I feel like they only really want if they're not having a procedure or if they're not a confirmed. So basically, if they're not having a procedure or they're not a confirmed coronavirus patient, then the hell with you. You feel me? I just started this job. I haven't even been here a whole month. You get what I'm saying? And I told my manager, I sat down with him. We had 2 orientations, and the first one was smooth. Then they had this one with this one lady. It wasn't making sense, the shit she was talking about. Then I cut when she, gave us a little break, I pulled my manager to the side because, we've been having remote training. Because, everybody can't be too close to each other. But I'm like, I'm not feeling this. We can't have PP on, on in these people's rooms and different stuff. I'm not feeling this. We just trained to wear PPE and the reasons to wear PPE, and y'all telling us, y'all not wearing that. It's crazy. I just feel at this point, I just want to, I have to have a remote doctor's visit tomorrow. I can't even go to the doctor. I have to do it from home on the laptop. I just feel like once he let me know like what's going on and give me my healing time and stuff like that. And I actually want to sit down with my managers and see what we can come up with my employment. When I go back to work and I am healed, I do want to wear PPE. I want that accommodation. Or I won't be working, and I will be contacting a lawyer at this point because it's ridiculous. We got to be protected too. I love working, you feel me? And I love making money, and I love helping people, and I love making people feel better and making them smile and feeling good about themselves. That's why I'm in the healthcare field. But what I won't allow is these trifling ass managers to deprive the workers of PPE and they have it in the hospital. They can't say they don't have it. And even if they are affected, they have their own PPE, but we should be allowed to have our own too. You feel what I'm saying? And we transporting people, all through the hospitals and these nurses and, pulling us to the side. Like, y'all need to be careful. These people getting tested for coronavirus. It's taking 48 to 72 hours for the results to come back, and all they doing is slapping masks on these patients while they coughing and doing whatever. To have us take them all over the hospital for testing. The results not back. And the ones that's clear, I understand, you feel me? Like, okay, they can be moved around, go to CAT scan or MRI or wherever they need to go. But the ones that's affected and they have, like, signs up, we not even supposed to be moving them. And we got to move patients with the shit, the tier 1s, tier 2s, and it's just ridiculous. I'm just coming on here to vent to you guys that, you know what I'm saying? Just tell y'all how they want these hospitals open, these fast food chains and all these other places open. They won't give us no fucking supplies. So it's just like, especially the healthcare field, you want people treated and you want these people better. But what the fuck about your workers? What about us? Are we supposed to die? We supposed to put ourselves on the fucking defense line like we in the army, taking care of people and y'all can't give us no supplies? No. Either it's gonna get fixed or it's gonna be a lot of cases when this shit is over with. Because people are going to lawyer up. And if my company doesn't come to their senses, I will be having to get my lawyer too. Because I just don't understand why I can't be protected at work.